Everyone, and welcome to the We the People, by the People, for all the people call. So what we are is a group who advocate for the rights and well-being of individuals with disabilities and their families in the state of Florida. Our mission is to basically unite families from across the state by fostering personal connections with local legislators, because that's how change is made. But through sharing our stories with those legislators, we aim to create positive change in legislative policies and improve access to vital services like Medicaid and iBudget waivers. So we have these calls and we are recording this call. It will go onto our YouTube channel, which I'll put that into the chat. We also have a Facebook page, a Facebook group, and a website. And the website has all of our information on it. I'll put a link to that on the website as well.
flcdadvocacy.org.
It's super easy.
Advocacy.org. It rhymes. And when we're a group, Amanda, we're a group of what?
We are a group of families and self-advocates and providers.
Yeah, we're really a group of people who love people with developmental disabilities, family run and family led. So if you're new here today, and I do see quite a few new people, I just want you to know you have entered into a space where you can be yourself, and we're here to really try to elevate the conversation, the policies, and the connection with developmental disabilities.
Yes.
So, welcome to our 3:00 meeting. We have these meetings regularly throughout session. We start really rolling out more or less weekly. I have the schedule. We took off for Thanksgiving break and holidays. But from here on out, guys, if you are free on a Friday at 3:00, we do meet every hour or every Friday at 3:00. And we have the reason why we start session doesn't start until January. But what's happening now is all our legislators have left their home base and they are in Tallahassee. And I think last week was the first week of interim committees into this week, which I'm still learning how I figure out who's on first and when, but I have been paying attention to the Florida channel. If you don't know about the Florida channel, it's like the Florida C-SPAN. It tells us what's happening in Tallahassee. We get to see these committee meetings as they happen, which is really cool. And if you miss them, their website has video archives where you can go back and see old meetings. This week, I figured out that I can go into the search bar and I can type in APD, I can type in disabilities. So if those meetings if something's happened, they pop up. And in the last
they put tags at the bottom.
And there's just been already so much conversation. There's 3 meetings that I saw that talked about our folks. One is really exciting. So I can't hold the carrot. I'm just going to rip it off. At the Human Services Subcommittee just the other day, it was on the 15th, Wednesday, our brand new director of APD, Bob Astalos, came and presented on actually House Bill 1103. And at the very end, Representative Mello said, "Hey, so what's up with the wait list?" And he was able to announce that working with the governor's office and with the budget people, that they were able to offer 5,612 people eligibility off the wait list. Let's let that settle for a second, because that is huge. So if you are on the wait list right now, if you've been there for a while and you didn't receive a letter, contact your local regional office. Make sure that your information, your address is up to date, that they have the way to contact you, because
that your category is correct.
Let them know, hey, I heard 5,000 people were taken off this list. I get my golden ticket. I would like to get onto the waiver. Let them know.
So 50% of those people turned it down also, which it sounds like a lot of them turned it down because they didn't think they were eligible for Medicaid. So if you want to jump into that a little bit too, because just because your
We're just
family's not
chomping at the
eligible.
bit here.
Oh,
Yes. So one of the other things that came from both presentations, so Bob Astalos came in, he spoke to the House Healthcare Budget Subcommittee and the Human Services Subcommittee. And I had a conversation with him myself. And this is the part that's been a little blurry for me. What he said was 50% of the people that they call and say, hey, you're eligible, or they write, hey, you're eligible, are not accepting waiver enrollment. I think there were a few things that was said in that meeting that gave me a little bit of clarity. If an individual is in an institution, an ICF, they're still on the wait list. So we have somewhere south of 500 people in ICFs, I think. And so that's a part of it, but that's not 50% of 20,000.
Stop
And
muted.
I think that a lot of times I've had quite a few girlfriends that I know who have not updated their address and been in contact with their pre-enrollment waitlist coordinator. I don't know that the agency prior to Super Bob, I'm going to call him Super Bob, that they've done more than send one letter. And I have seen those letters. Sometimes they may not be as clear. And one of the representatives in that meeting actually said for families that are dealing with very complex situations, they may not understand this is an eligibility letter. And so I would really encourage families to let your friends know if they're on the wait list, to check yourself if you're on the wait list, because the last thing that I would like to see is for them to take people off the wait list, which was a small part of one of the presentations too, was how do we get these numbers to accurately reflect people who need services. And then the other part of the conversation I thought was I'm a little all over the place because I just uploaded these, by the way, to our YouTube channel, so you can watch these entire meetings, but I've spent all morning getting these ready for you, so the meetings are like going together. Was a lot on the transparency pieces. I thought the website, if you have not gone to the APD website since Super Bob took over, you should really check it out. It's so much easier to understand. And they have there under very easy. It's like under resources and then agency reports, you can see the updated enrollment numbers. So every 5 days they're updating. So I looked today and there's 20,037 people on the waiting list. And just 2 days ago, their last report that came in, it was 20,199. And so I used a calculator in the last 2 days, 162 people said, yes, I need these services. So I love that data piece. Is there anybody else who tuned in, and anybody else who tuned into the meeting want to chime in on other parts? Alan, anyone?
One interesting that may not be of top concern to you guys, but it is with regard to capacity, because you've heard that the biggest need is adult day training, that there's not enough. There's wait lists everywhere. And the legislature passed some proviso, or it might have even been in law actually, to look at billing by the month. And they use this actuarial study group. They're called Milliman. And they did it, but what they did is they did it cost neutral. So how much was spent on ADT was how they figured they could pay for the month. And the problem with that is it's probably worse than the way they do it now, because what we were trying to get them to see, and they're listening, they actually said during the meeting that we're reviewing this because this doesn't make sense. It was the first time they said ever, I think, in at least since Barbara and those other people were in a leadership role, that we're working with providers to make sure what we're doing actually has the intended consequence. But what we want is when they commit money to providers for ADT and providers build out the program, that they're not nickel and dime to death and keep pulling money away, because that money ends up going back to the general revenue fund, but they've already committed it. So when they do the formula, we want them to use all that money because we're trying to expand, especially if they're taking 5,000 people off the waiver. And the conversation was really good to that. And I feel really glad I got a great relationship with Bob. He's the most open. He is military. He believes in chain of command, but he's not scared to hear things that are a problem and have his staff do it. And I think it's going to take a while for the staff to understand his goals. To me, they're pretty obvious. He wants to help families. And I worry about him taking 5,000 off all at one time. I would have staggered it like maybe 500 every week to just see where they're going, because he said in one meeting that half of the people didn't want services, but I don't know if that's right. I think these families all want services, some services.
There was a
Now,
bigger conversation had about that too. I'll tell you later.
Okay.
Yeah, I was
And
going to mention that.
I do agree the people in assisted living facilities should be kept separate with maybe an asterisk on the list, because they waive their right. They didn't waive their right to an institution. They went to an institution, and there is a separate line item to get them out. But we want them out and they want out, but it's actually cheaper to get them out, but they're not ready to come out. But I think knowing that these 500 or however many they are isn't really part of the same group. And Bob agrees. We've gone back and forth on that, talking about it. He saw that issue too. But I like the way he framed that, how it's a wait list, but it's not actually, when you say wait list, I understand his differentiation between wait list and who needs services now. I still think there's an issue with 0 people in crisis. And
Definitely. I have 2 people I'm working with. They're waiting in crisis.
here's my thought. I think I might have a proposed idea for him is how many, when they're approved for crisis is one thing, but when they get services is another thing. And what we care about is when they get services. They may wash their hands of it, that they're off the wait list, so that's not our problem anymore from that perspective. But really, the real rubber hits the road is when they get services. And maybe there's a way to distinguish the two, because I understand him. If you're in foster care and you're homeless and you fit that category in crisis, you're automatically getting on the waivers. They say, okay, you're in, we're not going to measure it, but you took a year to get your services. That's important. Those are probably the most critical cases.
And the other part of that is that 5,000 number is, in our area, we have no CDC Plus certified waiver support coordinators. And do we have, right? There was like 2, the last person I worked with, where they had support coordination. And so that the utilization of the service, like, I want to see not just, hey, when we said okay, but when these people are getting the help they need, because that was over a year. That was incredibly painful.
I think one of the challenges is that the more the iBudget has less flexibility, the more people are going to flow to the managed care, just because that's why we're fighting so hard for ADT, because I guarantee you that the pilot, or whatever it's called, ICSC, I mean, there's 4 letters I remember.
ICMC.
Yeah, YMCA, but they're going to pay bill by the month, so providers aren't losing money because they need capacity. iBudget, they're more rural oriented, and they're not looking at the big picture about how we do capacity. So there's conversations on how we can level the playing field, because we do want it to be a fair competition, and maybe dealing with transportation and some other things.
On the ADT thing, I did watch that. My kids are not quite at ADT age, and so I need to pay attention for when they do. And I saw something how they were saying if the individual goes less than 16 hours, we'll go back to hourly, but then monthly. And is that in the rears?
We know it started October 1, but we asked for the proviso monthly and daily so we could manage the ADTs. The APD fought both of them, but they put in monthly. And the thing is, once you hit 16 days, you get paid for as if they went the entire month. So you're staffing the place. Now, whether they come or they take a doctor's appointment or they're sick one day, it doesn't impact staffing the place.
Got it.
And that's what it's about.
Yeah, because the idea is you have to staff for the amount of people that you have enrolled in your program, regardless whether they're there or not. And then if you take a doctor's appointment.
It's really the service authorizations. When they get a service authorization, they plan to have people there, the ratios and everything. And that's why I think the service authorization is what they should go by, not how much is spent. Because there's a delta there that's about, it could be 15% or 20%, but that's the same deficit. That money, we looked at one provider, it was about the same deficit, the money they planned for versus the money they got.
And so that was something that resulted from last session's general money thing, right?
I think Carrie
Yeah.
presented on that in front of the delegate, or she presented in one of the committees.
I think the transparency is huge. You already nailed that, Stephanie, but it's so night and day how we're feeling. I believe in Bob right now. I don't know if he's gonna be able to get it done, but his view is a certain way that supports our efforts. It depends what obstacles are gonna get in his way. I'm trying to think, there were a couple of hearings. I know Summer testified at the end of session because they didn't get her card in time, so you may not have seen it. But she testified at the end of one of the things about the adult day training, and that doing it the way you're doing it. In fact, if they're doing it the way they want to do it, I would not participate because you end up losing more money because you're only getting a set amount of money and you have to staff it as if based on previous things. You're basically managing prior deficits at that point.
You know how Bob had said he met with families and he's met with providers. Other directors have said that before, and that I didn't know those people that they talked to, but I spoke with Bob. I have ADT providers that have spoke with Bob, and one of the things he said is I'm getting calls and I handle them personally. I had 2 families that had some problems with what their waiver services or the waiting list, and they both came back to me and said, "Oh my goodness, the director responded to me." That's something that cannot be, like, there's no price on that, because the trust that was broken with families saying, hey, they don't really want to help us, this guy is going the mile. And so I want to talk to all the people who might not be mouthy like us. If you have concerns or you want to say thank you, man, anything, I would get in contact with Director Estalos. Let him know we're cheering you on, buddy. How can we help you? Because not only do we want to work with legislators, we want to work with the agency that serves us. And for the first time, I feel like I can say with complete realness, this is legit. This could be a huge turning point for our population.
A quick story on a provider is a provider called me because they were called to a meeting, almost like you were called to the principal's office for something that they didn't do wrong, but they think they knew what they thought they did wrong, but they were really brought to the principal's office, and they called me. They wanted to hire me. I said, don't hire me. Here's Bob's email. Send them a short email. And within a day, they treated him with respect. It wasn't like being called down to the office. And he was like, things have
Get your
changed
dad.
now. It's different. It takes a while for it to get down to the lower levels of the organization, but they're getting it now, I think.
So the other thing that he addressed in the Human Services Subcommittee was House Bill 1103. And there were many things that he touched on, but I wanted to, while it's on my mind before I squirrel out, is family care councils. We had like amazing legislation passed to help get our family care councils back to being operational. And gosh, I can't even remember if it was last weekend or the weekend before. I went to Jacksonville. Alan was our keynote speaker. Anna was our all things coordinator. Amanda was there. There were several of us in the group that came up to Jacksonville. And I was hoping, Anna, Alan, if you guys would share about connecting the dots real quick, and then we can go back to what Bob was saying in the meeting on family care councils.
Yes. And hi, everybody. I'm Anna. I'm the co-chair currently for Family Care Council Area 4. I've served as chair, and then I've served as the chairperson for the Connecting the Dots committee for the last 3 years. And Connecting the Dots is a huge multi-agency partnership style conference that we do in Northeast Florida. It is presented by Family Care Council Area 4. And this year was the 9th year. So next year's 10. Big anniversary, so everybody come out for that. But this year I feel like, and I've gotten a lot of feedback, that this year was the best year yet. And there are a few things that I think were key in making that happen. First and foremost, Alan. There's always a good time to be had when Alan is there. Second, we had great turnout and great buy-in from across the whole state. APD really jumped on our bandwagon this year. And so we were trying to get ACA and DCF to come out. A big thing that we've been seeing from legislators is that they just think that none of these agencies work together, which from experience, we know they don't. And so we were trying to show that this is possible, right? Everybody can work together. That is a possible thing. APD pushed an initiative and they really rode them hard. They got the leadership from ACA, who manages all of their administrators for Medicaid, and then the same from DCF to come out to this event. So I was able to set up 15-minute appointments starting at 11 o'clock, running through the entire conference, single one-on-one appointments with APD, ACA, and DCF. You could pick either three. And then I had all three of their tables right next to each other in one little section. That was probably one of the most impactful things. We saw issues that people have been dealing with for months, right? They couldn't get through on phone calls, literally fixed in seconds, which by the way, goes to show that if you can just get on the phone with somebody who knows what they're talking about, these things are simple fixes. And that's frustrating to an extent, but also look what we can do when we pull that together. Having Director Astalos there was huge. I know we had quite a few providers there. A lot of the coordinators in our area come out to this. And this time around, APD did offer CEUs, which was another attraction for everyone. But the providers were asking questions when he basically just opened it up for all of us. Hold on, buddy, to get your dad. Sorry. I have a little person in here. He opened it up for questions, which by the way, is not the way APD has ever done things in the past. When we had Director Hatch there, everything had to be approved ahead of time. She was not wanting any public questions that she had not vetted beforehand. So for him to stand up there and say, hey, throw it at me, all, and they did. And he answered. And to throw in a little bit extra, I got to see him the next weekend as well. He came to our ARC of Florida leadership meetings during advocacy days at Disney. And he pulled me aside afterwards, and Amanda was there. And he really wants to meet with a few key people from Family Care Council to discuss some things and how we can support each other. But instead of getting that slimy feeling that you get from a lot of politicians, honestly, one-on-one with him, you get the complete opposite, which is a rare thing. So I'm impressed. I'm encouraged. And the fact that he has his contact information right there on the website, transparency, I do think, and we showed during some of the conversations that there are a lot of things that he's not getting the full story on. But of course, when you're at the top of the food chain, you don't always get the full story right away because everyone wants to impress you, not tell you about all the problems. So I think the fact that he's going out talking to providers, talking to families directly, he is much more likely to get a real picture of what these things look like. It's not going to be an overnight fix, but we're moving in the right direction. So any questions about connecting the dots that I can answer for anyone?
I'm going to fill in some blanks there for
Yeah, go for it.
Yeah, so connecting the dots is Family Care Council Area 4's mini cafe, if you will. We had over 500 people is the number that keeps getting thrown out.
Yep, I had
And
550 people registered and just over 500 actually showed up.
it was so beautiful. Alan's a great speaker, and I learned some things about the zoo that I ask people every single day. When you go to the zoo, what's the first thing you want to see? I learned a lot from that one moment. But also, I live like pretty south of Jacksonville, so it was so cool to meet hundreds of families, or it doesn't matter where we live, we're all the same. We all connected. There's people that I met in Jacksonville that I can't wait to go see at Cafe. I cannot wait to see at DD Day. And just like the family morale that happens in those spaces. But that's one area out of 15. So our family care councils, there's 15 around the state. And the idea, I think Anna's evil plan there was so that Areas like mine, Area 8, we could work on something like that. Your area could work on something like that, because it was dynamite for so many reasons to go in that expo fair and see the local providers. Family Cafe is a little, yay, oh my God, I'm tired by like row 3. And so to be locally and to see who's around you that can help serve you and your family, that was super cool. And this
And we're here to
conference,
support everybody. If you want to try to do it in your area, like, reach out. We want to see it everywhere.
so I think what was really cool with my conversation with Bob, and I was like, I know what Anna was doing, and I think it's a good idea, was his response was, I think it's a good idea too, and let's all talk about that. Because it does take coordination. We want people to be there. However, that's one event. Our family care councils meet every month. And these family care councils are family run, family driven, and they're an advisory to the Agency of Persons with Disabilities. So the entire idea is that we get together and we all share in the commitment of what we can do in our local area. You also connect with families in your local area. And I've said this on this meeting a lot, but if you're new here, you get to hear it. When I first rolled into the world of APD, if I did not meet people at my family care council meeting, I would have been a very different advocate, because I was so angry. But I had some missing details, and they really helped educate me and like love on me, which it's really hard to do on Zoom. Like, even though we meet weekly, the hug thing, the whole connection part, and meeting people that you can go later for coffee and talk more and to get connected with local resources. These all happen at these family care councils. But over the years, we have lost a lot of family care council members, people who really put their heart, blood, and soul into it, and they grew up their kids and they're moving on. We haven't had appointments in a while. So last year, there was a bill passed in 1103 that really helped streamline the appointment process, and also had a creation of a statewide family care council where then you have your local councils and one at the state, where the local councils report to the state council, and then the issues that happen in Naples that also happen in Port St. Lucie and all the other parts of states, Florida. When you see those sort of same type of things going around across the state, then we can work with the agency on those challenges and not make it like truly collaborative. And so that was the intent of at least this person that was involved in that bill. It was passed. So Bob came and gave his report, and I found it really interesting that only 2 local family care council appointments have been reported. So this is my big pitch. These family care councils meetings, they are on our website, on our calendar. If you don't know where your family care council is, it's fccflorida.org.
In the chat.
Local, you can find your local council, but we have every meeting that meets around the state on our website. You can click it and find out about it. Get involved in your family care councils. This could actually really affect policy changes and make a difference.
I think,
1 hour a month.
I think people that have applied need to reapply because they're not counting all the old applications. When they said they only had 2, it means all these people that have applied didn't apply. They should notify them of that, but they haven't.
Correct. So I have been asking this at my local council, do I need to reapply? And I have gotten a flat line of answer. And so what I heard the other day is 5 days ago it was 248 people who had applied. And then and then at this committee meeting, he said only 2. So the 247 people, your applications have been cut off, forgotten. Please reapply. If you're not involved, go see what it's about, because this is a huge deal and we have a heck of an opportunity. If only 2 people are saying, hey, we want to do this, that's not going to be a heck of an opportunity. They have not put together the state committee yet. However, I did get the same response from Bob that he would like to get some people together who are really interested and invested in making this work, because he, in his veteran space, what he was telling me stories, and that those family driven councils, they should be the ones creating the policies, because we are the people that know how to help. And so that was really encouraging for him to hear. So does anybody have questions on Family Care Council, because I just want that to be something we think about and do. And
I have a question in general. I know Anna said that I can join the Area 4 one, but the area I'm in, I can't remember now if it's 7 or 11. It's based out of Orlando. I think the head is going through cancer, but the couple times I've tried to log on, it's just been not worth my time. They've got me on, I can't even interact with the people. And there's very few people at the meeting. So it seems like it's semi-dead, which would, if she's going through cancer is understandable, but
that would be the perfect one for you to get involved in. And so I would apply, because it takes one person to change how a council goes. Go ahead, Alan.
I just wanted to mention something else that Bob had said that I think is important to all of you. There was a group of about 50 families in Indian River County talking about families that are looking for group homes or services, but they don't know where to look. And Bob said that he's going to set up this, he's going to use the system that the nursing homes and the assisted living facilities use, so families can not only find places, but also see their scores on their Clarent. And I think that's important, because I know when my dad needed a rehab facility, it was so easy. It was like his county, I knew the two best. It was like, it's going to really, there may still be capacity problems, but at least you can know where you're looking at, and it's just not random.
I thought that was, do you think that that would grow to all the provider services we have?
Yes.
Respite, personal care, all of that?
I
So
think
he
so.
said that he has already been in talks with ACA in getting that whole resource, because he came in at the advocacy days for the leadership meeting or sessions or whatever. He actually came and spoke on Friday morning, and which was incredible, because usually in the past, no director has shown up, from what I was told by Dina. And usually the other director came with a whole entourage. He came by himself. He went on a run Friday morning with the people in the group that run. I'm not that people. But he talked for about 10 minutes, and then he said, okay, you guys hit me. Tell me what's going on. Tell me what your concerns are and everything. And they didn't hold back, and they were respectful, obviously, but they were like, we're not getting referrals. If we are getting referrals, they were just sharing all of their issues. And 3 minutes into him listening to people, he picked up his phone and he goes, I'm not texting, I'm taking notes. And he was steady taking notes the entire time. It was awesome. And I had the opportunity to talk to him afterwards, and I was like, Bob, I'm gonna give it to you straight. A lot of us feel like we've been in an abusive relationship and trying to trust.
Exactly what she said.
Yeah, Anna was standing right there. I said, and learning to trust someone new, it's
Delicate.
a little hard. And he goes,
we have to take up running. We have to all start running.
No.
they did walk a mile for
He's
the
gotta have other
walkers, and then the runners took off and ran 2 miles.
Yeah,
And I'm like,
and Summer, by the way, was like dying, and
it was great though. But his response to me though was, I have to deliver. And the fact that he understands that all of these things that he's standing up and saying, that he knows he has to deliver.
he knows
on
he has
that.
limited time too, and he's pointed that
Right.
out quite a bit. He knows that his time could be very limited, and he's very
Mission
adamant that,
oriented.
he's very adamant that he wants to make the best of the time he has and make the most impact and difference, because he sees
The need.
he said some things that I won't repeat here because they were said, I think, but he pointed out some of the really big issues from previous administration with APD. And he was very forthcoming in how he said it, and he wasn't apologetic, and he didn't back them up. He said what he thought, and that I appreciate that he made a beeline for us after the talk before he was leaving to make sure that he got an opportunity to chat with us and express an invitation. Also, that made me look really great in front of my ED. So just gonna say it's all good things.
Sylvia is in the chat here. I'm just like, if you have chatted, take yourself off mute because I haven't been paying attention. But I'm looking a couple of times about CDC Plus and the clearinghouse, and I thought that was a good point because recently the APD has required that representatives of CDC Plus are getting their clearinghouse, their background checks done, and each area has different deadlines when they need to make that happen to continue with services. My mom did she's our rep, she did the clearinghouse, but I can ask her about that. I'm not sure what the
What was the
challenge is.
question?
Yeah,
'Cause
Sylvia,
I was just working on that
talk?
today.
Can you talk, Sylvia?
You're muted, honey. Let
All
me
right,
find you.
ask to unmute.
I got you.
Hi.
There she
Hi,
is.
Hi,
good to see you.
as well to everyone. The challenge that we're having with CDC Plus, of course, we all have, like you said, the regions have a deadline. And my son, he's a representative. He is trying to do it early because there's a backlog with people trying to log in and doing the background screening. Unfortunately, the server, we have to go, once you have to go into the clearinghouse, log in there. Even though my son has already got his credentials, he's been a representative, he can't get into the server. My son is a computer engineer. He understands how to do this. He works for Department of Defense and he can't get in. So it's something done with the portal.
Have
And
you gotten with your support coordinator on, because that, now I'm like, you're triggering things. That's what my mom did. She got with her support coordinator and she gave her instructions on what to do next.
I went to downtown Orlando. I went to the ADP office in downtown Orlando just to share this because it's a concern. Why are we having this? And
It's a new system, and that's probably there's gonna be bugs for sure.
My mom got it done like right before the deadline, but it didn't take long. Like it was quick and simple once the support coordinator gave her the lowdown on the login stuff. So I'd get with the support coordinator and see if they can. And I think I see Melissa on here. She might have some insight to that.
I would appreciate it because I'm not, it's annoying.
Yeah,
and
you want to get it
frustrating.
done.
We want to get it done, the earlier the better. We don't want to wait till December. It's better now because I think Central Florida is a big region and it's going to be infiltrated by the time December comes. So we
Right.
want to do it now. And I don't know, maybe if we're doing it early, maybe that might be the problem, that we're doing it early and they don't want, I think Central Florida is Region 7 and they don't want Central Florida to do it at this, I don't know. And so that's why I talked to Lydia, the CDC Plus in Central Florida. I wrote her a letter, documented it, and this is what we're having. So she might escalate it and go up to, she has to go to CDC Plus up in Tallahassee so they can figure out why some people are having issues, or not some people, a lot of people are having issues. It takes a while. This is our challenge right now. And that's why I went to downtown.
I wish Tom was here because he always tells me he is on the CDC Plus.
Oh, yeah.
I'm not sure what it is, but there is
It's
some
it's like
meeting.
it's a board. Yeah.
Yeah, there is some oversight committee
Or what is it?
that they meet.
It's an advisory
quarterly.
board.
Advisory board. If anybody has the information that might be a great spot for you to see that, to help give them that.
They just started meeting again. I think what he said, because he's been on it from way back, but it didn't completely off. It didn't happen for years, and they just started meeting again, I believe.
It's like quality control CDC Plus. I wonder if that's on the fancy new website. You know what? I'm gonna look into that, Sylvia, because I
If
do
he
like.
can share, yeah, my son has emailed the clearinghouse several times. He gets no response back. And so this is what's so annoying.
Hey, Adrian did mention in the chat, I hope I'm pronouncing that they sit on the CDC Quality Assurance Council.
There it is.
Are you
There it
able
is.
to speak? I've asked to unmute. There you are.
There.
Can you shed some light on this?
Yes, I did post also a new helpful video that they developed for the background screening system. I put the link in there. I don't know if you guys can open that up, but it should be a video of the background screening process. So that was one of the concerns that we raised, was the new system is a bit more challenging, and could they do something for us? I asked for a step-by-step, but we got a video. So I shared the video.
Sweet. I'm snagging that.
Where's it at? Where's it at? Where's it
It's
at?
in the chat.
It's in the chat.
Somewhere up the chat waves. I'll
Oh,
find,
yeah,
oh, there
there's
it
a
is.
chat.
App.screencast.
Is there an agenda?
I'm just gonna look at it.
Huh?
I'm gonna see.
So it should be going up on the state website soon, but I asked if I could share today, and yes, we can share it. So hopefully that helps.
How about that? Thank you so much, Adrian.
You're
That's
welcome.
perfect.
I can't find
One
it.
thing, one
I'll
thing
put
I
that
would,
out in the group too.
one thing I would do from a strategy on how you fix a problem that can't be, that you've tried to do things, but you can't fix it, is I
Yeah.
would send the email to Bob in such a way so he can identify the person who can help you and let him know that you'll follow up when it's complete, because that person's going to get the email forwarded to him and know they're being watched. It's just the way it is. That's what I used to do when I was a CEO.
Yeah.
Is you want to put them in a situation where they don't have to do the work. They just have to identify the person because you've hit a roadblock. But I would always tell how it impacts your family also, the issue and the efforts you've made to that point. But I would try to make it very short. In fact, if you write it up and send it to me, I'll edit it in a way that is receptive.
Yeah.
What I've done when I email Bob is I always do an analogy dealing with the Navy.
That's brilliant.
Yep.
And he
I'm writing
gets
that
it
down.
because I want to do analogies with the Army because I was in the Army, but I agree to do the analogies with Navy.
That's big.
That's smart. And then I saw in the chat a little bit further down something about how do you get a support coordinator? I can't find it. So I'm guessing did you just get onto the waiver? You just got your letter of eligibility? I can't find your chat anymore. So if you could.
It's Eileen. How do you
Eileen.
get a support coordinator?
Eileen, so when you receive your letter of eligibility, you'll also shortly after receive a letter. It should also come in an email with a list
Eileen.
of support.
Yeah.
Eileen, a list of
Eileen, yeah, sorry.
support coordinators that are in your area. And then you can give them a call and interview them and find the one that works for your family. If you haven't received that letter, you've got your eligibility and you haven't received something saying this is your list of support coordinators, you can contact your regional office. So I don't know if you're still on the phone because my screen's set up funny, but if you wanted to ask, because this is really important, this is really your first step into getting into actually services. So if you had anything on that, feel free to unmute or put it in the chat. And then I wanted to cover.
I asked her to unmute.
I'm unmuted.
Hey.
We're so lost that we're trying to follow everything and this and that.
I know you. Oh,
Yes,
glad
of course you do.
here.
We've
Oh, good.
emailed. We're not even sure what we tried to get on. What was some site that you've sent us? I don't want to take up time on this call.
No,
And
you're
we
good.
could not get on. I'm very computer savvy. I teach from a computer, but we could not. It kept bouncing us off. So we're not even in the first step. So
I think
we're
you're
lost.
talking about the online application. You went to just create an account, right? And it didn't.
Yes, we
So-
created an account.
Goodness, I'm sorry. I thought I got back to you while we're here. When you go to set up an online account, they will send you a code in your email, and sometimes that goes to your spam to activate it. So
Is that
you
what
may need to try that again. I would even just, if you have a different email address, start over from scratch and then check your spam or check the spam that you have, because what they're doing is they're trying to validate that email is yours. And you're local to me.
I'm in
Call me
Naples.
after. I'll come meet. We can come meet and do this together.
Okay, I'll get back to you. I just didn't want to bug you because you're
But
busy.
so what you're at pre-step 1, right? You're going to apply for services for your son. And then when services become available, you will get a letter of eligibility to saying, congratulations, you're now enrolled. And we will send you a support coordinator, a list of support coordinators. Now that support coordinator part is really important because that is the only required service that you have to have. So you cannot get any of the other things like we talked about, personal care, some residential services. You can't get anything without that support coordinator. And they are like they are your gatekeeper to
got it.
Tallahassee. So that's something that'll be down the road. Really important folks to get in contact with. But I can help you with that application.
Well, we'll
I'm
take
glad
a
they're here.
stab at the application again. I messaged you, but I'm sure you get 1,000 emails like I do. So I appreciate everyone's help and support. I'm very grateful. So thank you.
Oh, I'm glad you're here. We're families, and this is exactly the space to come in here. We do have a website, fldadvocacy.org. If you put your email in that, we will get in contact with. We have a network of people that can help you through this process, and that's a lot of what I love about this group is we're all willing to help.
Can you put that in the chat? Because
Yeah.
I've been copying everything that you've put in the chat.
All right,
I'll
sure.
throw it in there.
Thanks.
Thank you very much, everybody.
And then there was some guy that we talked to in the beginning of the meeting, and he was cool.
Brian.
He's an ABA guy. Brian, he gave a list of something we have right now. I think is this Aaron Nagel's thing? Brian, are you with us still? Brian in Tampa?
I asked him to unmute.
We might have
He's still
lost him.
there.
This is pretty cool.
Sorry, the unmute wasn't working. I'm still here.
That's all right. So I love this website. If you wanted to tell families a little bit about it at all.
So that website there is actually from Clarent itself. It's their review is right from their database. You can search by area, you can put your zip code, search by miles. Now it doesn't give you exact addresses for houses. I've looked at other states for that. Trying to look at like an apartments.com thing, but there was some security risk and health and safety risk about that when I brought up the APD. So those are the actual company's contacts. So they might have 1 billion houses, and they might have one, but they might have 100 service providers within that one company, or it could just be a solo. But it gives you a list that you can start contacting, and parents could and just start at the top and start working your way down.
That's super helpful. I've not seen that before. That's great.
And then you can see their scores. And if you see no score, that means they're brand new.
So it was what Director Babo was saying is put this on the APD site, or does anybody know?
Yes.
When I typed in my zip code, which I'll just say is 34113, there's only one provider in the 50-mile radius. That can't be right?
Can be very right.
That's it's telling.
Representative Tant said the other day that there was only, Alan, didn't she say there was only one ADT in Leon County?
Yep, she did say that. I heard that.
Yeah, I heard that too. And I was like, what?
Yeah,
She
and
said
that's
that,
not
but-
surprising, and a lot of people are gone too.
She said that, but it's not exactly right, because I know of another one that's a faith-based one. Maybe they're doing it off the books. I don't know, but there's only one real one that's really, it's called Pyramid, but I think there's the Arc of Leon County too, Arc Leon or something.
Yeah, you would know that.
Well, they're not an Arc chapter. A lot of people use
Yeah.
our name to get people to come there.
My
Well,
bad.
I say R, I'm not the Arc CEO anymore, but
I know.
once Arc, always Arc.
Yeah,
Yeah.
you act like you're not involved.
Yeah.
Were you the one down in Naples?
Who, me? I'm in Naples.
Because you said you had 0 results.
No, I have one result. Community Resource Network.
What were you looking for, an ADT?
I don't know. I was just put my zip code in to see what I found. And Community Resource Network, Rosalind's usually on this call. They are definitely we the peoplers for sure.
Oh, because I just put in for an ADT, and for Naples, there's pages of them.
What?
One,
Oh, so
2,
maybe
3,
so that's
4,
it. I'm searching
5,
this
6,
wrong somehow.
7, 8, 9, 10, 11,
What?
12, 13, 14. Yeah, within a 50-mile radius.
Provider search. I just did zip code. Oh, and service.
Try like behavior analysis. within a 50-mile zip code in Collier. Day programs are okay, but like behavior services and stuff there's particular pockets where there's a lack of providers. It's not all providers. And Alan, you're right, with the Leon County being the 1-day program, and there is that faith-based one that's there that is not a waiver provider as well.
Oh, you're awesome, because I don't need ADT, but I do need behavioral, and there you go. Melissa, it's so good to see you. You sound like you have been talking a lot. I know that Melissa Mazzeta, if you don't know, she's like the mother of our group. She's started all this fun stuff with families, and she is always in Tallahassee. Anything? I don't want to make you talk because it sounds hoarse, but anything you want to throw in there at the end?
I was up there this week when Alan and I got together, and there's a lot of changes going on. I really do like that the new director is very open to input. He's not keeping everybody at arm's length, and he really is taking in, I think, all the information. And one of the things that he had said to me was that he didn't want to just have a bunch of ideas and then them disappear. So he's putting together a work group to really try to address those things. And I was at the state office yesterday for another meeting with somebody else that he had brought in. And I'm gonna put together they were asking about just ideas for efficiencies and especially with the 5,612 people that are looking to go on to the waiver, and APD is having the regional operating managers are talking to us as the QO owners about taking on people. And in order to come onto the waiver, yes, you have to have a support coordinator, but now that support coordinator also has to be able to offer CDC, because that was part of a House bill that James Buchanan did in 2024. So they have to be able to offer that. And you want to have meaningful provider development as well. We want to get a support coordinator, okay, but what is it that you're in need of? And we want to be able to connect people to services, and we already know that there are particular shortages in different areas, targeting what is needed in particular counties. And now I did receive the list of the amount of letters that have gone out to the amount of people in each county. And the central region is the one that's getting the most. I think that it was like 1,732 letters were just going out in the central region. And that's a pretty large region. And there are some rural counties, and we have to have consideration when you're talking about rural counties and availability of providers. And that's where CDC can be exceptionally beneficial. It's beneficial in urban counties too, but in rural counties in particular, there really isn't a lot of services. So anyway, there's a lot of moving parts, but making sure as families that the delegations are still going on. Legislators are coming back to their districts. They got stuff that they need to do, but then they're going to have committee weeks again in November, I believe the first week, and then the third week of November.
I have it on my calendar.
Yeah.
First
But they're not back to back. They're actually, the weeks are set.
every other week.
Yeah.
It started
Yeah.
the 3rd, and then the 17th, and then December 1st.
So Nicole is actually really helping with that, getting that calendar together so that we can get that information for families. But we have 1 minute, so I'm going to try to get this quick. The delegation meetings are very important. They are still happening. We have plenty left, and the delegation dates are listed on our website as well as the ARC or many places. If you have questions about that, please reach out to us. I did in the chat put examples of our families who have gone to these delegations, and extremely powerful. These messages are very powerful, and it's interesting to see how alike things have become, even though these are highly personal. So it's beautiful when when the mission plays out, and going to our delegations is very, very impactful for making those relationships. So I highly encourage that. And I want to make sure that everyone knows, I put the calendar in the chat as well. The next meeting that we're having is October 24th, and it's going to be a big one. I'm excited about this. Senator Gail Harrell is going to come on and talk to families. And so is Representative Meg Weinberger. So we will have someone from the Senate and the House. And I'm so glad that Senator Arrington had something come up because I almost had 3 next week and I was like, how do I do that? But she's going to be with us on December 5th instead. And so next week would be a really great one for families to come hear from the people that represent us. And we will have all that information in an email for you. I just want to thank you all for coming on today and spending your Friday afternoon. And we love you guys. So have a great weekend.
Didn't you want to mention about sending emails with questions for Senator Harrell ahead of time?
Oh, thank you. Thank you so much for that reminder. So for Senator Harrell and for Representative Weinberger, if you had questions you wanted to ask already, if you think of them through the week, you can send them to info@FLDD Advocacy. And I think that would be really helpful so that they know what families are looking for as far as for information. We can get that to them ahead of time and try to get those questions answered. So it's info@FLDDadvocacy.org. Okay. Happy weekend.
Have a good weekend, y'all.
Bye.
Bye.
Bye. Thank you for joining us.